Today on our 50 Shades of Pain show, we're talking about treatments for the second most common cause of chronic hip pain.
And that is around the sacroiliac joint.
Welcome to the 50 Shades of Pain show. I'm Dr. Donish, the medical director of Wellward Regenerative Medicine, and I'm here with George and my co-host.
George.
Oh, Big George.
Big George.
And my co-host,
Dr. Escaloni.
So our 50 Shades of Pain show is meant to empower our patients to help take control of their pain problems and demystify the whole problem of pain. Healthcare doesn't do a great job of resolving some of these pain issues. They just kind of mask it and put a Band-Aid on it. Our goal is to actually educate people so that they know the difference between a masking problem and actually fixing an issue. A couple weeks ago, we talked about the two most common causes of chronic hip pain, and it's not osteoarthritis. They are
Gluteal tendinopathy.
And now we're going to talk about
Sacroiliac dysfunction.
and what kind of treatments you can do for it. So, James, show us what the sacroiliac joint actually is.
Fortunately, we've got a wonderful model. Take
George.
a look at Big George's booty right here. All right, or the lack thereof. That's maybe why he has a problem. All right, but right here, this is your sacrum. This is your ilium.
Triangular bone.
This thing right here, this big thing right here is your ilium. SI, sacroiliac joint. All right. So why does this have anything to do with the hip, though? I'm a little confused. Should we tell the audience?
Well, to give you a corresponding area of the body, and this isn't to show off my booty, but it's this area right here. A lot of people, when they say I've got hip pain, they're referencing this area right here, but it's not really the hip itself. It's that sacroiliac joint. However, the sacroiliac joint and the hip are actually very intimately related, because if you look at the whole pelvis, this is a ring that the spine sits on, and then all of that stress is redistributed to the hips. So if you've got a dysfunction in the sacroiliac joint, it's inevitably going to translate to dysfunction within the hip and even the knee over time.
All right. So one of the things that we like to tell people is that for SI dysfunction, you've got to have good exercise. That's one of the top things for the human body, to make yourself resilient, strong, and to make sure things are held together a little bit better. And you'd be working all these muscles of the hips, some of these abdominal muscles, your rear end, all that good stuff in there. And that can help it so that this joint's moving better. However, that's not always the best thing, because there can be something left out.
Yeah, so generally speaking, this is a ring that needs a very strong, stable foundation. A lot of people who have sacroiliac pain, it's often labeled as an arthritis or an arthropathy, or arthropathy means a problem with the joint. It's rarely a problem with the joint. The joint itself is not that dynamic to develop arthritic issues. However, there's a complex of ligaments that hold this thing in place. And as we age, just as how our skin develops wrinkles, our ligaments can develop wrinkles too. And that introduces just a little bit of give in that sacroiliac joint. Now, James, you drive a car, correct?
Not well, but yes.
If you're in your car, your tires were not aligned, what would you do to compensate for that?
I'd be constantly going back and forth with my hands so that the steering wheel keeps me on the right spot on the road.
Right, so you're compensating for that misalignment by turning the wheel. And if you kept doing that for thousands of miles, what do you expect to see?
I'd have some very specific wear patterns on my tires.
And that's exactly what happens with the sacroiliac joint. You get a little bit of laxity that starts to give a little bit of wear. And so your muscles have to compensate for that. And what those muscles are doing is they're using the hip as a leverage point to try to stabilize or pinch together this joint. If exercise is not working, I mean, that is the first line treatment, is to strengthen these muscles so that they have a greater degree of ability to compensate, kind of like, changing the wheel on a steering wheel. But really, ultimately, we need to strengthen the ligaments. And there aren't great solutions for that with conventional approaches.
Now, also, one of the things that I am proud to say we do at Wellward is we do the most thorough physical exams possible. Because if this ligament's a problem, or if this ligament, or this ligament, or this ligament, it's all the SI joint and can cause a problem here. Our physical exams, we figure out where that pain's coming from. then we know where to put that injection.
Yeah, and we're using ultrasound and x-rays to put them in very discrete spots so that we can understand which of these ligaments has lost its integrity and is causing that little bit of wiggle to take place. Once we have that down, then we can introduce a lot of therapies that have that longer lasting effect, like orthobiologics and PRP and even bone marrow derived products that will have a very high potency of repairing tissue.
Don't forget, on some of our previous episodes on the 50 Shades of Pain show, you can
Previous what?
episode of the 50 Shades of Pain show, you can learn about all the stuff you need and how PRP, prolotherapy, all that stuff works to tighten us up much, much better than stuff you'd get elsewhere.
Please find us on our social media outlets or our webpage, wellwordmed.com. We're on Facebook, Instagram, LinkedIn. If you have any questions about this, or if you're dealing with sacroiliac pain, please message us and ask us any kind of question. We love to hear from people because it helps us know what to plan for our future shows. And if you have any kind of questions, by all means, ask us and we'd be happy to answer them online. Join us next week on our 50 Shades of Pain show. Come see us on our wellwordmed.com webpage. And until next time, I'm Dr. Donish.
Big George. I'm Dr. Escaloni, and we'll see you next time.